Your patient received excellent clinical care, but now they're facing a confusing, potentially overwhelming hospital bill. Do you feel equipped to handle their questions and anxiety, or does discussing healthcare billing feel like it's outside your scope, another responsibility added without the proper training? Many nurses grapple with this. Yet, helping patients navigate financial concerns is a powerful form of patient advocacy. Ignoring their stress impacts trust, patient satisfaction, and can even hinder the hospital's RCM process by delaying payments. It's time to embrace your role as a trusted guide, even in financial matters. Welcome back to the Healthcare Nurses Network and Nurses Link Up mobile app podcast series. This is Breaking the Code, Nurses Unlocking Revenue Cycle Management. This series is your essential guide, delivering the financial knowledge you deserve to navigate the full healthcare landscape effectively. In Episode 8, we focus on patient education and financial counseling, helping patients understand their bills, written by Dr. Nicholas Abella. You'll discover your advocacy role, how guiding patients towards financial counseling and resources strengthens trust and enhances the care experience. Simple guidance strategies, practical ways to provide basic patient education on terms like deductibles and co-pays, and confidently direct patients to billing experts. Improving the system, how nurses facilitating financial clarity contributes not only to patient satisfaction but also to smoother RCM operations. Guiding you through these essential strategies are your hosts, ICU nurse James Carter, BSN, RN, and nurse manager Emily Ramirez, MSN, RN. Get ready to break the code. Your RCM transformation starts right now.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast. We're today into something that can be kind of a tricky part of healthcare.
Yeah.
And that's the whole billing side of things.
Right.
Now, we know you guys, you're the heart of patient care, but guiding patients through this whole world of billing,
Absolutely.
it can be really impactful on their whole experience.
Mm-hmm.
So we're going to explore how you can really help them understand it all.
It's so important. And I think what's really interesting here is that,
Yeah.
we always think about nurses as the clinical experts,
Right.
but there's this whole other side
Yes.
of patient care
Right.
where patients are just bombarded with information.
Oh, yeah.
And especially when it comes to costs and bills, and
Yeah.
you're the one they see all the time.
Right.
You build that relationship. So you're in this amazing position to really be a guide for them.
Absolutely. And to be honest,
Yeah.
sometimes those medical bills, they look like they're written in a different language
Oh, absolutely.
with all the codes and abbreviations.
Yeah, it's enough to make anyone's head spin.
Exactly.
And it's no wonder that sometimes patients, they even put off seeking care because they're so worried about the costs.
Right. And that's what we want to address. Like, how can we as nurses
Yes.
make this whole process less scary?
Exactly. And then, it's not just about making things easier.
Yeah.
I mean, that confusion that patients feel, that can actually prevent them from getting the care they need.
Absolutely.
And it just adds so much stress to a time that's already difficult.
It does.
So we really need to think about how we can bridge that gap.
Yeah.
And nurses, you guys are in a perfect position to do that.
Yeah. And I think it's important to make this clear.
Mm-hmm.
We're not saying that nurses need to become billing experts.
No. Of course not.
Right.
Yeah.
It's more about giving them the tools to be, like you said, that guide.
Exactly. You're the navigator.
Yes.
You're not the one doing the billing, but you're the one helping them find the right path.
Exactly.
Yeah.
And when you think about it,
Yeah.
a patient who's already dealing with a health issue,
Mm-hmm.
that added stress of not understanding their bills,
Oh, it's huge.
it just makes everything worse,
Absolutely.
right? So if we can give them that guidance,
Yes.
if we can just let them know that there's help available.
And just that feeling of knowing that someone's there to help
Yes.
can make such a difference.
It really can in their overall well-being.
And you know what I find really interesting here?
Well, what's that?
Is that we talk so much about, the hands-on care,
Right.
the emotional support that nurses provide.
Yeah.
But this idea of guiding them through the financial side of things,
Absolutely.
it's like a whole other level of care.
It is.
Yeah.
And it really builds on that trust that patients already have in you.
Exactly.
You're the ones they open up to.
Yeah.
They share their fears with you.
Mm-hmm.
So when you say, hey, I know this billing stuff is confusing.
But let me find someone who can explain it all.
Right.
That means the world to them.
It does?
It builds trust, not just in you, but in the whole healthcare system.
So let's talk about some practical things that nurses can do.
Okay, I love that.
Right. So what are some actual strategies?
So one of the biggest things is just letting patients know
Yeah.
that financial counseling even exists.
Right.
You'd be surprised how many people have
mean-
no idea
Yeah.
that there are people whose job it is to help them with their bills,
Mhm.
to explain payment options,
Yeah.
to see if they qualify for financial assistance.
And it doesn't have to be a big, long explanation.
No, not at all.
Our sources actually gave us a great example.
Oh, perfect.
You could say something like,
Yeah.
our financial counselors can review your bill with you and discuss any available payment plans or financial assistance program.
Exactly. Just a quick heads up.
Right. It's clear, it's concise,
Yeah.
and it might just be the thing that helps them get the support they need.
Absolutely. Sometimes just knowing where to go is half the battle.
Totally. And
Right.
and another thing that I think is really important is helping patients understand the language of billing.
Oh my gosh. Yes.
Because let's be honest.
Yeah.
Like deductible, copay, out-of-pocket maximum.
It's like a whole different vocabulary.
Right. It's like they're speaking a foreign language.
And it's not fair to expect patients to understand all of that.
Exactly.
It just adds to their stress.
It does.
So we need to make things clearer for them.
So how do we do that?
Well, one way is to provide some simple handouts
Okay.
or direct them to trusted websites that explain these terms in plain language.
Yeah.
You know, imagine a nurse handing a patient a pamphlet that says, understanding your healthcare costs.
Love it.
Something simple like that can go a long way.
It really can. And what about those situations where
Yeah.
patients have more complicated billing questions?
That's where knowing who to refer them to is key. Nurses aren't expected to know all the ins and outs of billing,
Of course not.
but you are the experts in connecting patients with the right resources.
Right.
So if a patient's confused about multiple bills, for example, you can explain that those often come from different departments
Yeah.
and then give them the contact information for the billing office.
Perfect. So it's like you're streamlining that process for them.
Exactly. You're making it as easy as possible for them to get their questions answered.
And there's another aspect of this that I think is really important.
Oh, tell me more.
And that's talking to patients about preventative care.
Oh, that's a great point.
Because it might seem like it's not directly related to billing,
Right.
but it can actually have a huge impact on their financial well-being.
It absolutely can.
So how can nurses bring that into the conversation?
Well, by educating patients about the importance of things like
Yeah.
regular checkups, screenings, vaccinations,
Mhm.
you can help them understand that catching things early can actually save them money in the long run.
Exactly.
You could say something like, keeping up with your screenings can often help us catch potential issues early, which can save you from more expensive and costly treatments later on.
I love that because it frames preventative care not just as good for their health,
Yes,
but also good for their wallet.
exactly. It's a win-win.
It is. So for nurses who are thinking, okay, I want to do this.
Yeah,
I want to start integrating this more.
I love it.
What are some concrete steps they can take?
Well, first of all, keep it simple.
Okay.
Use clear language.
Yeah.
Avoid jargon.
Mhm.
You know, instead of saying financial aid services,
Yeah.
you could say, we have financial counselors here who can explain the different ways you can manage your bill and answer any questions you have.
I like that it's very straightforward,
It is.
very patient-friendly.
And always be proactive about giving them the resources we've talked about.
Right.
You know, offer that brochure about financial assistance.
Yeah.
Provide the phone number for the billing department.
You know, anything you can do to make it easier for them.
And I think it's also important to create an environment
Yes.
where patients feel comfortable asking questions.
Oh, absolutely.
Because this can be a sensitive topic.
It can.
So, you know, just reassuring them that there are no silly questions, that
Oh,
they can
that's-
ask you anything.
And you know, you can say something like, please don't hesitate to ask any questions you have about your bill or your coverage. There are no silly questions, and I can help connect you with the right person who can provide clear answers.
Perfect. And the great thing is
Yeah.
that incorporating this doesn't have to be this huge extra thing.
No, not at all.
You know, it's small steps.
Yeah, little things done consistently
Exactly.
can make a big difference.
Like those educational handouts
Yes.
or just mentioning financial support services during discharge planning. Exactly. You know,
Yeah.
you could say, before you leave today, I want to make sure you're aware of the financial assistance programs that are available if you have any concerns about managing your hospital bill.
Right, just making it part of your routine.
Exactly. And it's important to remember, too,
Yeah.
that this isn't just a solo mission for nurses.
Right.
Collaboration is key.
So working with the billing department.
Absolutely. Having a good relationship with them.
Yeah.
So you can refer patients seamlessly and even following up with patients to let them know you've passed their concerns along.
Right. So it's like a team effort.
Exactly. We're all in this together.
And, maybe even a checklist.
Oh, a checklist. I love that.
Right. For nurses to make sure they're covering all the bases.
Yes. Something simple like briefly mention financial assistance options or provide contact information for billing inquiries.
Perfect.
Just to keep everyone on track.
Okay, so now I want to address the elephant in the room.
Oh, okay. What's that?
Because I know some nurses might be thinking, this isn't really my job. I'm here to provide care,
Right.
not to deal with billing.
And that's a valid feeling.
Yeah.
But I think it's important to remember that patient advocacy goes beyond just the clinical aspects of care.
Absolutely.
When you help patients understand their bills, when you connect them with the resources they need,
right,
you're actually contributing to their overall well-being.
That makes sense.
Reducing financial stress can have a huge impact on their health.
It really can.
And it builds trust in the healthcare system.
So it's really all connected.
Exactly. It's all part of providing holistic care.
And to do that effectively, it helps to have at least a basic understanding of billing.
It does.
You don't have to be an expert,
No.
but knowing the basics
Yeah.
can give you the confidence to really support your patients.
Exactly. The more you know, the more you can help.
So really, nurses are in this unique position
They are.
to be champions for their patients.
Yes.
When it comes to this whole financial side of things.
Absolutely. They bridge that gap between the medical care and the financial realities.
Right. And they make sure that patients feel supported every step of the way.
That's what it's all about.
This has been such a great conversation.
I agree.
It's so clear that nurses have this incredible opportunity
They do.
to really make a difference in their patients' lives.
And what's so powerful about this is that by simply offering some guidance, by connecting patients with the right resources, nurses can alleviate so much anxiety and really improve the whole healthcare experience.
Absolutely. And we want to make sure that you, our amazing nurses, have all the support you need to do just that.
Absolutely.
We're here for you. So if you're looking for more information, more strategies, real-world solutions, head over to healthcarenurses.net.
That's a great resource.
It is, you can connect with other nurses, share your experiences, and get access to a ton of valuable resources.
It's a fantastic community.
It is. And you can also connect with other nurses through our Nurses Link Up app.
Oh, yes.
You can download it on the Apple App Store and Google Play Store.
It's a great way to network and learn from each other.
It is. So before we wrap up, I want to leave you with this question.
Okay, I like this.
What's one small thing you can do in your next patient interaction to offer a little bit more guidance on the financial side of their care?
Love it.
What simple phrase or piece of information can you share that might make a real difference for them?
That's a great challenge.
I hope this has given you some helpful ideas
Me too.
about how you can support your patients through this often confusing world of billing.
It can be daunting, but you guys are making a huge difference.
We are.
Just by being there for your patients.
Remember, your role as a patient advocate goes way beyond just the clinical stuff. And we encourage you to think about how you can incorporate these strategies into your daily interactions to really empower your patients.
Exactly.
And build those strong relationships.
That's the foundation of great care.
It is. So for more resources and to connect with other nurses, visit us at healthcarenurses.net.
It's a great website.
Or download the Nurses Link Up app from the Apple Store or Google Play Store.
Awesome. Thanks for listening, everyone.
Thank you for listening to the Healthcare Nurses Network podcast.
Hi, everyone.